Hello, this is Dr. Bouvier with Dr. and You, and you've come to the video to learn a little bit more about mood disorder. And this is a training video, and I want to introduce you to a good friend and patient of mine who's been living with mood disorder about ever since he can remember back in teenager, right?
Right.
There was something that switched, and he couldn't sleep at night. You just couldn't shut it off at night, and you had a few of these relationships that were destroyed, and you were just kind of wondering why. Then your family and friends came together and said, well, you have a mood disorder. Here's how we're going to treat it.
Correct.
For most people, what happens historically, they don't get that in their young adult age or their teenager years. They usually get it at 30, 35 because they've got this whole big long line of screwed up relationships and they just don't quite get it. Kevin is lucky enough to be one of the people that had good family support, good caregivers and people that supported him, and he understood that in order for me to be able to function normally in life and be able to go to college and everything, have family, etc., you had to take your medications basically for the rest of your life.
Yes.
So in general, mood disorders are pretty interesting. What you focus in on, if you could come a little closer here, what happens with normal people is that you have this in normal people. You see it okay?
No, I can.
Okay, so people kind of live their life, dipping down and, depression maybe for a few minutes or hours at a time. Some people days, and that's when you have to treat it. But, all of us have a few minutes to hours of a season or something where but we're normal in this mood disorder, or in this normal range of mood. What happens with people with mood disorder is that they oscillate sometimes in hours or even days. They have this cycle where they cycle into manic side and then depression side. With my friend here, he cycles, but it's primarily in the depression end. And so in treating all mood disorders, if you can remember 1, 2, 3. Number 1, treat the mood first, depression second, and then relationships come third. If you try to lob off the depression side first with just an antidepressant, which happens with a lot of people, is this cycle here now shifts all the way up, and they become very manic, and because you didn't treat the mood disorder, the manic part first. Okay, so what you do is treat the mood first, the depression second with medications, and then you get back to normalcy. They're always going to have, a few minutes to hours of the day in a depression, but they realize that they're out of it. Like Kevin today, came in and said, hey, his depression has been lasting more like days, so now we know we got to make a medication change. And that's what he's here today for. So just remember, take-home points here. Number 1, this starts usually in early teens or 12, 13 years old. They can't quite shut it off at night. Just can't shut their brain off at night. And number 2, they need medications for life. And the sequence is so important. The third take-home point here is that you treat the mood first, depression second, and this could be just days to weeks in between, and then relationships can come. Let me say that again. Mood first, depression second, and then relationships, come and stay. Right?
Right.
Again, this is Dr. Robert Bouvier with Dr. and You. Have a great day.
I did that, but...